My name is Marianne Brodmann. I'm the head of the division of angiology, vascular medicine at the Medical University in Graz, Austria. The reason and the rationale behind the SAVER subgroup analysis was that, first of all, it's really a real-world registry of more than 1,800 patients included in this registry, which can be evaluated. And the reason for the subgroup analysis is that we need to have a closer look on subgroups who need more attention when we do endovascular treatment. And this is for sure gender, because gender is not that much taken care of in the RCTs. Usually there are less female in RCTs included than males. First thing, and females behave different in BAD disease and with the outcome in endovascular disease. And the second one is we also need to look for complex lesions and certain risk factors. And that's the reason behind that. That gets more and more important because this is not taken care of in the randomized controlled studies. The patient population was, a patient population of Rutherford category 2 to 6. So really everybody was included in this registry who needed to undergo revascularization for symptoms relief, either claudication or wound healing or rest pain. So that was the patient population. It was a registry which has been conducted at 60 sites across Europe. The key findings are that also in a real-world registry, the Stellarex Balloon was behaving really in a well way. So it's a low-dose paclitaxel-coated device, and it was efficient in the whole patient cohort. And even if it came down to the different kind of subgroups we were analyzing, the complex lesions, the patients, the females, and the patients with diabetes, and the different kind of clinical symptoms, Rutherford, the first group, which was just claudication, and the ones with critical emphysema, there was no difference with regard to the efficacy and the safety of this device. The take-home message is that independent of what we face during our endovascular treatment, what kind of patient population, it doesn't matter what kind of gender, it doesn't matter what kind of complexity of the lesions, what kind of underlying risk factors, the Stellarex Balloon, which is a low-dose paclitaxel-coated device, is efficient in achieving a good clinical outcome and is safe. I think this is the most important thing. So it's an adequate to be used tool to treat all kind of patients who present with critical emphysema or claudication. For sure, further in the first space, we need to have a closer look on gender, disparities, race, underrepresented minorities, and this also in Europe. So we need to take care of the different kind of patient populations we face in daily life. And I think this is very much needed with all the devices we want to evaluate and develop in the future.